Back to the real news. The government again delaying a provision of the health care reform law. Republicans say the president's rewriting the laws around the election calendar. ABC's Tom and Bradley explains.
Under the new guidelines, people will get to keep their old plans for 2 more years, even if those plans don't meet the requirements of the new law. The new set of regulations helps insurance customers, but it also helps Democrats facing a political problem in this fall's midterm elections. Without this change, there would have been a wave of cancellations of health care plans before the November election.
Andy Hetzel, Vice President of Corporate Communications for Blue Cross Blue Shield of Michigan. Not necessarily want to comment on the politics of it all, but really about the machinery of how you get health care these days if your company doesn't offer it. Welcome back to the program.
Oh, thanks, Michael Patrick. Well, it certainly complicates the business of health insurance, and every time one of these decisions is made in Washington, we as a business and our competitors as businesses have to go back to the shop and figure out what to do next, and that's what we're in the process of doing right now. We kept one of our pre-ACA plans open. It's called Keep Fit. It's not open to new enrollment, but some members that were in that plan decided to keep it. But we really intended for that plan to be a bridge into ACA-compliant coverage. We intended for it to be open for a year. And one of the tricky aspects is that because we had anticipated as a business having to change over all of our plans to comply with the benefit requirements of the ACA, we didn't increase rates in any of those plans. So if we keep old plans open like Keep Fit, we might be looking at a substantial rate increase need next year. And, you know, it puts us in a bind. We don't want to do that to our customers. But if we're going to have old, antiquated plans open and in the market, we have to catch up on rates. And so we're considering the impact of yesterday's decision, and we're considering what to do next, and we're going to take into account feedback from our members, state regulators, and others before making any final decisions.
And that's across the board for everybody. All of you, yourself, Blue Cross Blue Shield of Michigan, and all your competitors, too. The whole industry is in a sort of upset apple cart. True?
Yeah, it's the same for all the businesses that are offering health insurance and regulated under the requirements of the Affordable Care Act. When changes are made like this one, we have to go back and assess what we need to do as businesses to respond to those changes, and what we need to tell our customers.
Now, what about the customers, too? They're wondering, they know there's a March 31st deadline. Maybe my company doesn't offer insurance anymore. What do I do? What are you telling them?
Yeah, thanks for bringing that up. March 31st is the deadline. If you are uninsured and you don't get coverage by March 31st, you cannot get it again until November. So for people who are uninsured, call us at Blue Cross, 888-483-3387. Go online to bcbsm.com. We've got people to help you. We've got tools on the web. But March 31st is the deadline, and we're encouraging people to call us sooner rather than later.
Okay.